Welcome everyone. Today I'm going to discuss on very important aspects of healthcare systems. So what we learn, explain the basis of health insurance and coverage, demonstrate the complexity of the healthcare cost and the large variations in out of pocket cost based on insurance status, with the impact of insurance coverage and out of pocket cost with the ability to adhere to treatments recommendations, explore how provider reimbursement model can affect delivery of high value care, encourage physician not to practice one size fit all medicine. An unsure patient perspective. Mr. M is a 28 years old man who served as a abdominal pain ED diagnosis of the reputed appendix treated with IV antibodies for 4 days. Patients, I grew up in a family without health insurance my whole life, and our policy was basically give it a couple of weeks. Julian McCann, Commodity Records, told a storyline how is New York Times. It had adherents, this American life, how much no health insurance days in a hospitals, approximately $45,000. Cost dollar amount for provide to deliver a healthcare system charges the financial amount of healthcare provider ask for a service often must higher than cost and reimbursement only in uninsured patients are bill charge reimbursement amount of third party player my drive charge inflation price the amount of patients pays out of pocket for a service hardest number of estimate but this matter most to patients. Health insurance sources. Employer base 46%, Medicaid 17%, Medicare 16%, uninsured 8%, military 4%, ACA exchange 3.5%, ACA medicals 3%, and other 3%. An individual person pay a premium directory of a health plan or insurance company which is reimbursed provider plan offered directly from insurance companies or through marketplace or exchange. Employer usually pay all part of the premium for the employees. Tax deduction business expenses not counted as taxable income for employees. In essence, government is subsidized employee sponsor with health insurance. Insurance type government in the last 1950 less than 15% of the elderly had health insurance. In 1965 Medicare's and Medichild was entranced. First tax finance government insurance. Medicare plan structure, hospital service, physical service, voluntary presence, Part C, supplementary insurance. Medicare plan structure, Medicare insurance plan for the elderly, financial through Social Security at the age of 65. Those there are medical part B insurance the elderly by physician service, financed by federal taxes and monthly premium forms available to those eligible for Medicare part. Medicare part, voluntary prescription coverage that is added to original medicine plan have a monthly premium in addition so that the paid to part B usually tied formulations with copyrights deductions vary but may not exceed $405. Medical average plan. Beneficiaries can enroll in a private health plan and receive Medicare coverage. Medicare pays private insurers as a set monthly fees per members. Plan must cover Medicare's Part A and B. Plans vary reference for specialty care, restriction on out-of-network care. Medicaid, federal programs administered by the state record coverage inclusion hospital, physics, laboratory, and radiology. Pharmacy coverage is optional but currently is provided in all state. Coverage group non-elderly, low-income personnel and disabled. No requirement for priority tax payment. Pre-SEA adult without dependents children, low-income families, moderate income families, undocumented person. Aims to decrease the number of uninsured Americans and reduce health patients in 2010. Expansion of coverage, individual mandate, medical expansion, health insurance exchanges. Ongoing challenges, access to healthcare. 62 years old presenting the ED with dense right hem pressures and emphasize CT scan confirm a large MCA infections and her labs reveal previously undiagnosed hypertension. How did her lack of health insurance contribute to the outcome? Does health and insurance make a difference? Fewer regular medical visit and prevent health screening, low survival, increased mortality, less care during hospital, less likely to receive a costly test of procedure, higher in hospital mortality rates. Small group of activities. A 37 years old man present to his PCP, which progress, no history of tobacco use or alcohol use. Physician example was normal. You tell the patient that you think should see a gastroenterologist and get an endoscopy. The patient asks you what he can explore to pay. Case out of pocket. Work in group to complete the chat using healthcare blue book. Use healthcare governments and how do you pocket cost affect adherent to the treatment. Out of pocket cost, there are many interesting things happening, so we need to be very much careful. Diagnosis related group. Physician or hospital is paid one sum for all the service delivered during one illness. PIDEMS, the hospital is paid for all services delivering to a patient during one day. Free for services, the physician or hospital is paid a free for each services. Caption, one payment is made for each patient's treatment during a month or years. Accommodation cares, ACCA authority created by CMS in 2010. Definition, doctor, hospital, other healthcare provider who come together to coordinate high quality care for Medicare and Medicaid, could ensure the patients get the right care at the right times without duplication, service or error. Realism value with payment incentives. Steps toward high value care. Understanding the benefit, harms, and relative cost for the interventions. Decrease and eliminate intervention that provides no benefits. Choose intervention and care setting to maximize benefit. Customize a care plan that incorporate patients' values and concern. Identify system level opportunity to improve outcome. Summary: insurance status, type of coverage, out of pocket cost affect adherence to recommend treatment plans, give large difference in coverage, affordability. We must all seek to individual patients' care to improve quality, safety, and decrease unnecessary cost. This is different kind of reference for today's sessions, and today's sessions is very important how we can grow our economy in an effective way. And healthcare insurance is very important, and we need to be very much careful about that. And healthcare insurance actually very helpful for the developing nations. uh, and and I request everyone, please join our forum in an effective way. Thank you.